Hi everyone, Dinesh Sirisena here, and today we're going to be talking about imaging the deltoid ligament. As with my previous videos, I recommend two resources. Firstly, the ESSR guidelines on musculoskeletal imaging, and in this case for the ankle, and also ultrasoundcases.info. So here are the images from the ESSR guidelines. The deltoid ligament is over the medial aspect of the ankle, and remember it's quite a broad ligament with the anterior, middle and posterior portions to it. You can accentuate the ligament by asking the patient to dorsiflex the ankle, and this brings it into a more superficial position. Remember also that in addition to the anterior, middle and posterior bundles, there's the deep and superficial components that you want to try and assess as fully as possible. Sometimes what you might want to do is start at the anterior portion and sweep the transducer posteriorly so that you assess it as fully as possible. In practice, this is how you can position the patient. So asking them to lie down on the examination couch in a side-lying position with the ankle of interest facing upwards. This exposes the medial aspect of the ankle and makes it much easier to examine the deltoid ligament. If you have the foot hanging over the examination couch, it means that you can both actively and passively move the ankle so that it brings the deltoid ligament into a more superficial position. I would typically use a linear transducer when undertaking the assessment. That's because you can keep one end of the transducer over the medial malleolus and then sweep the transducer through to have a look at the deltoid ligament in its entirety. If, let's say, the space is quite small, you might want to transition to a hockey stick transducer, particularly when you're undertaking the dynamic assessments. And this is what you're hoping to see on the ultrasound. On the one end is the tibia, or the medial malleolus, and then distally is the calcaneum. In between, you should see this triangular and linear structure fanning in the space, and this represents both the superficial and deep components of the deltoid ligament. Remember, it's important to scan from anterior to posterior to make sure that the deltoid ligament is intact throughout the structure. In situations where there has been a sprain, you may see hypoechogenic changes suggestive of tearing within the deltoid ligament. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter, Instagram and TikTok. And remember to check out sportsmedinfo.sg. Thanks again, and I'll see you soon.